The next area I'd like to talk about is a diabetic ulcer or a wound on your foot. The majority of amputations are preceded or begin with a wound on the foot. Now, for those of you that already have an amputation or those that have had a wound, I'd like to explain a little bit of how that wound began and what can be done to treat it. A wound usually begins on an area of high pressure or an area where there's increased friction. Starting with the high pressure area, if you have a callus on the bottom of your foot that is needing to be treated and trimmed down, if that callus isn't trimmed down for an extended period of time, it can get harder. Research shows that underneath a callus, it's actually about 60% harder. It's not able to bend the skin. The skin isn't able to adjust. And that can happen and create a wound underneath the callus. When someone trims down the callus, it looks like there's a blister underneath. That blister is actually the beginning of an ulcer. It's very, very important then to have those calluses trimmed down. That can help with reducing the likeliness of developing an ulcer. Along with trimming down a callus, it's going to be important for us to treat an ulcer with special accommodations inside of your shoes. These are special multi-density inserts that fit in with your diabetic shoes that can reduce the friction on the bottom of the foot. These are very, very effective to those individuals that have an ulcer or a wound on the bottom of their foot to help prevent it from happening. Once again, I want to thank you for the opportunity to speak to the New England Amputee Association, and I hope you find these videos helpful.